Well, it's not a question of deserving. I think it earned it. The impact factor, which that's based on, is a calculated metric that depends on how often the articles published in the journal are cited by other papers. So the fact that the journal earned that standing is a testament to the quality of the papers that were submitted and that were published in the journal. I think that's a long-term process. The climb to number one has involved real focus on leading the journal into areas of anesthesiology that are cutting edge, that are of great interest to scientists, to clinicians, to the public, that has generated those citations. So I think those are the contributors, being at the leading edge of progress in the field and having a reputation as a very user-friendly journal that works closely with its authors and is able to create a journal that is satisfying to the reader as well, including both clinicians and scientists. So I think all those things have contributed. Being at the top at the moment, obviously that's where we would like to stay. I think it's not easy because there are a lot of other excellent journals in the category of anesthesiology and pain medicine. But our approach has been to really drive the field forward by sponsoring scientific conferences, by featuring special issues that highlight very topical areas in anesthesiology to generate submissions, to generate interest in the scientific and clinical world, and together generate some excitement that brings attention to the journal, attracts the best papers, attracts interest from our readers. And that's the vision I have. And I think that's really the recipe for the success so far. I think we're known as a very readable journal that has interesting papers for clinicians, but also has really cutting-edge research. And that's where the focus will continue to be. So we'll continue to work with our readers to create a journal that they're happy with, that keeps them up to date with the latest in clinical developments in the field of anesthesiology, and also that features the science and the research that is driving the field forward. That includes everything from procedural assessment and preparation for procedures in anesthesia, to anesthesiology and anesthesia itself, to critical care, and all facets of perioperative medicine. So it's a very broad field in a way that touches patients in multiple phases of their life, everything from newborn to geriatrics. So it's really a broad area that has a lot of potential for research that's relevant to the public, as well as they're more and more concerned with what the effects of anesthesia might be on outcomes, both early ages and elderly patients. So I think it's an exciting time to be editor-in-chief, and there's a lot of interesting work going on that will keep things exciting for the next 5 years. If you take a look at the journal, you'll see more and more how anesthetic techniques are being optimized to improve outcomes, both short-term and long-term. So comorbidities being managed to minimize the progression of the disease that the patient might have, and then the anesthetic technique being managed to reduce certain side effects of anesthesia, like postoperative nausea and vomiting, for example. So I think the focus on clinical outcomes is a really exciting area in anesthesiology that has relevance both to fundamental basic research and to clinical research. And large outcomes studies. So it's a really great time for the journal because we've been involved in many of these studies from the beginning, and I think we continue to publish really important papers in those areas. I wanted to be the leading outlet for studies that are going to impact the field of anesthesiology in improving the outcomes of our patients. So I want to be publishing the science that is the basis for the clinical trial that shows that a certain intervention is able to either reduce the stay in the hospital or improve the survival or reduce pain following a procedure in very high impact clinical studies that really build on the fundamental science in anesthesiology, and I would like to see the journal publishing that whole spectrum of research.